Hi guys, this is Dr. John Suber, plastic surgeon, and welcome to Straight Talk on Plastic Surgery. I'm very grateful for all of your excellent questions that have been submitted thus far, and I'm going to encourage you to continue to submit those via my email link on YouTube. Submitting questions underneath previous videos is a little more difficult to sort out, and you're less likely to be able to have me be able to see, document, and answer that question for you. So again, submit those via the YouTube email link. It's going to be a lot easier to track them that way. In response to your questions thus far, and the volume of questions that I've gotten so far, I want to get these answered and out on the web as quickly as possible so it'll benefit you. As evidence to that, I'm going to ask for an apology from my head, as I've had surgery this morning and I wanted to sit down and get some of these questions answered as quickly as possible. Today's question is an excellent one, and it deals with patients who are planning future pregnancies and yet at the time are considering a tummy tuck or abdominoplasty procedure. This is an excellent question and affects all patients considering a tummy tuck procedure, be it a cosmetic one or a procedure on the belly on a patient who's undergone massive weight loss, either on their own or with the help of bariatric surgery. In either case, this question is pertinent to you, ladies. Now, to answer that question, I'll start by saying that in my hands, in the large majority of patients, tightening of the muscles of the abdomen are a key component to what I do. I'm tightening those abdominal muscles from the xiphoid, right under that breastplate, all the way down to the pubis and even out to the sides. In my massive weight loss patient population, that abdominal wall tightening is even more extensive and more involved. So pregnancies afterwards is a more significant matter. Now, in short, generally speaking, I will tell you that if I know a patient plans future pregnancies, I will hold off on doing an abdominal wall procedure where muscle tightening is involved until after pregnancy stages are complete. The reason is, with pregnancy, the abdominal wall stretching occurs and we're undoing a lot of what's been done there. The subset of patients in whom I will consider doing a tummy tuck procedure on, even if future pregnancies are planned, is the subset of massive weight loss patients where abdominal wall tissue is even more extensive than usual. These patients, they're going to have their belly tissue hit the bottom in a standing position, hitting their knees, their shins, and I've even had patients when standing where the belly came all the way down to the ankles. In that patient population, we're going to want to debulk that tissue oftentimes even prior to the completion of their weight loss goal, because a lot of that weight will be in the pannus first and foremost, and secondly, that patient population frequently comes to me with significant symptoms that are impeding their ability to reach their goal, to have the normal activities of daily living without impediment. So in that patient population, I typically tighten the abdominal wall musculature less. Therefore, pregnancies are not an issue with them. As a note for that, in addition, that patient population who we do the debulking procedure on understands that the real goal after completion of weight loss and after the removal of that initial tissue is to come back a good while later and debulk any remaining tissue that's come back after significant weight loss beyond that, or to then tighten up the abdominal wall and do a formal dress-up procedure where the final results are shot for. Now, that having been answered, if you've had a tummy tuck and do get pregnant, fear not. I do encourage you to speak to your plastic surgeon so that the details of your specific surgery, your medical history, and your physical exam can be taken into account, and you can have good advice from a well-trained, well-experienced plastic surgeon. But generally speaking, fear not. That baby is going to be worth that abdominal wall laxity that will recur after that delivery. You'll be able to look at that baby and it'll be worth it, even though in many cases some of that abdominal wall tightening will be undone and it'll be necessary for you to come back and have that revised. So I don't want to put the fear in anyone who has had a tummy tuck and then becomes pregnant. Fear not. It'll be worth it. Visit your plastic surgeon beforehand and then afterwards, and he can give you a game plan that will suit your specific needs. That was an excellent question. I really appreciate that one, and I hope you all get a lot out of that. Remember, wherever you are, life is good.